Holly, back with another Ask a Director, and I have got the one and the only Julie Shepherd.
Hi,
Welcome.
Holly. Hi, everybody.
Since we last saw you, how are you?
I'm great. It's nice and hot in my office. I'm sure everybody else is feeling the heat. They're keeping themselves hydrated. It's important we keep hydrated and try and keep ourselves cool and get lots of ventilation. Keep our environments as cool as possible. And also, for COVID, we need good ventilated environments at the moment. So there's two reasons to have your window open at the moment. First of all, Holly, before we start, I just want to say a big thank you to everybody out there who continues to work during the COVID pandemic. In this heat, I know people are tired. I hope people are getting annual leave in and getting some downtime. It is important, but Team NHFT remain outstanding for me. So I just wanted to say that before we move on to the questions, Holly. So fire away at the questions.
All right, okay. Are you ready? So we've only got 3 questions for you today, but I think there are some good questions in there, and I think it's important that we focus on them. So the first question is, this person understands that there is no change to wearing face masks, but they're concerned they haven't been given any direction of how they would deal with members of the public who come in and say, well, I don't have to wear a face mask. So what is it they should do if they do come across any people not wearing face masks on one of our trust sites? And is there anything to say to sort of support them in this?
So I think there's a couple of answers there. As we say, nothing has changed in the NHS, and that includes the general public wearing face masks, face coverings, and our patients as well around face masks. We were very clear on that. And there has been some social media comms across ourselves, KGH and NGH, whole system approach to sharing the same messages around no change. One of the things I've agreed this morning with Jean Knight is we're going to put something in outpatients letters to just remind people coming to outpatients that there are no chains and the expectations remain the same. So Jean is on that today. We will be looking at that. At the end of the day, if people don't bring their face coverings with them, provide them with a face mask that we've got. We have got face masks available, and that is possible. We need to think about the risks that they are there when they come into an NHS building. The risk is higher than if they're going you're out in public. So actually, we need to think about that, and it's about explaining the risk to them and asking them to wear it. And if you have an issue, please do escalate it to your manager, who can support you in that.
Absolutely. Thank you so
much. And I think there's one more thing, is if there's anything else that we can do that people think would help, please do let us know. Anybody got suggestions on how we can reinforce the messaging? We are updating our posters, and I know comms are working on that, so we're putting some new posters in, aren't we? Because people are used to seeing the posters and they don't see them now, so we are looking at more posters in the trust for the public to remind them.
Perfect. Thank you so much, Julie. And I think it's such a good question to have in, because we know what we're supposed to do. We know there's been no change, but it is a bit difficult for people who aren't familiar with NHS guidance, who are like, but I don't have to wear my face mask. So I think it is really good to have that kind of clarification.
And I know there was also some national guidance, wasn't there, over the weekend from NHS I&E around this, that's nationally led comms that went out as well. And I know when Boris did his briefing the Monday before the 19th of July, he did then say in that briefing there was no change in the NHS as well, and in healthcare. So we just need to keep getting that messages out to the public.
Yeah. And we're the public too, aren't we, when we're not in work? So I guess if you see family and friends and you know that they're going for an appointment at local GP or the hospital, just remind them.
And I think that is a really good point. We're all ambassadors of the NHS and we can all share that messaging. So that's a really good point. Thank you, Holly.
You're welcome. Anytime. Okay, question 2. When the request to move back into the office comes, how is NHFT intending to keep staff safe?
I mean, as you know, at the moment, nothing's changed. So people are still being encouraged to work from home if they can. I know some teams are looking at coming back, but social distancing is still required in offices, and I can't even say it this morning. Face mask wearing is still required in offices. So actually, we need to think about that. All our accommodation had environmental risk assessments. And if you haven't seen them for your area, your manager does have that. And some of those may need updating, and if they need updating, health and safety and Cromarty, who's our health and safety lead, can support the managers in updating that. It is the role of the managers to do that because they know their environment best, but we can give them support. So it's important that we do maintain the same rules. And I know there is some work through the 4R Trust Recovery Planning Programme to look at staff returning to work if it is required, because I know some people would like to continue working from home, and some roles will allow that. So actually there is some work going on. It hasn't been published yet, but keep your eyes peeled on the staff room. There will be regular communication on it. And I'm sure it will come out through either Tuesday takeaway as well, or our Friday communication comms. So really watch this space. But my message at the moment is nothing has changed.
Perfect. It's interesting, isn't it? Because the message is nothing has changed, and even though nothing has changed, you have to put the message out that nothing has changed, because it feels like things outside of work, it feels like things are changing, but actually it's really important that
and I think that's the confusion, isn't it? From the 19th of July, things have changed in the public. Organisations outside the NHS and healthcare are making their decisions around what they're doing from staff. Some will continue with the guidance, some aren't. But NHS remains the same, and that is very confusing for everybody. And there are some tweaks in remains the same. So we know yesterday we did some work, didn't we, on car sharing? And there's a slight tweak in that, but nothing has really changed overall. But the national guidance is slightly tweaked on that. So I do recommend that people go to the staff room and have a look at the updated version on car sharing. But generally, most of it hasn't changed. We should still be wearing masks when in cars as health staff. It is important you still follow all this guidance. And the socially distancing is still important. And when you have breaks, think about socially distancing, masks off for a very short period of time. The shorter the better. Make sure you're 2 meters away from each other. The risks are still there. And if you can eat outside, that's even better. But you should still have the 2 meters and have your windows open.
Which is a lot easier during the summer months, isn't it, to have your windows open?
You make a really good point there. However, unless you've got the lawnmower outside your window while you're trying to record this,
I'd be sneezing. No, definitely. It's obviously difficult, isn't it? There are different environmental factors that.
And it's all about risk assessment. But actually ventilation is one of the biggest things. So it's hands, face, space, and for us good ventilation is good. None of that guidance has changed. Hands, face, space, and ventilation. To think about your environment.
Yeah, perfect. Okay, lovely. So please go and check the Staff Room COVID page. There's also a public version of the COVID page. So if you're not on the VPN, you can access that too, and we'll link that all for you. The last question I have is about the trust looking to recruit volunteer peer vaccinators for flu. So why do we need peer vaccinators, Julie?
Why do we need peer vaccinators? So last year we had a small proportion of peer vaccinators, and we want to increase the amount of peer vaccinators. We know last year it was a challenge for people to access clinics at times because of their workload. The clinics weren't on at the right time. So what we want to do more of this year is do vaccinations at service level and support that. That's why we want peer vaccinators. So we've recruited into the trust, and she starts, I think it's in 2 weeks, a lead peer vaccinator who will manage the programme. So it will be a supportive programme with some supervision. There is a lot of training. which many staff have already done, because actually we've got people out there who've done the COVID vaccine training, which is the basis of the training. There will be a slight addition to it, because there always is, depending on the type of vaccine you're doing, but it's still the basis of the same training. So we know we've got quite a cohort of people out there who are already trained, and it's about your team, thinking about your team. So we're not saying as a peer vaccinator, if you work for intermediate care, we want you to go and vaccinate Daventry mental health team. We're talking about you vaccinating in your own team to suit the needs of your colleagues. Yes, so that's what it's about. And the more vaccinators we have, you know, it may be in large teams we need 3, 4, 5 vaccinators, you know, to share it. The clinics will still be running. It's not replacing the clinics. You know, we are looking how we're making it easier to access the clinics. We're looking at how we can do things differently around the clinics. We've taken a lot of learning from last year. We did a lot of, we did a survey, didn't we? Because you helped me with that. And we've taken the learning from that. You know, we've talked to lots of people. We've talked to different organisations. And having talked to different organisations nationally, peer vaccination is the one thing they said was really positive and really helped them. And why do I need my flu vaccination? Well, we know the risk of flu is going to be higher this year. There's some guidance that's come out this week that's saying, because people, flu wasn't around so much last year because of the wearing of masks and things like that, we will have lost some immunity. They are really worried that people don't have the same level of immunity against flu as they would have had in the past, because flu wasn't around last year.
Yeah.
Yes. So actually it is more important than this year that we do have our flu vaccination, you know, and that programme will start in September. There will be a lot of information coming out. We've already started the planning, because you've been part of it, haven't you, Holly? You've already got your comms plan in place. You know, this is about keeping each other safe, isn't it? You know, it's about keeping your family safe, keeping yourself safe, keeping your colleagues safe, keeping patients safe, keeping their families safe. You know, this is really important this year, you know, and I know that there's a lot of work going on nationally around what cohorts will be, and they're looking at vaccinating an extended cohort of children. I can't give you the ages off the top of my head, but I know they're extending that as well. So there's a lot of work going on, because there is real national concern around flu this year and other respiratory illnesses as well.
No, that's really helpful. I think that there's a case study that's going to be online shortly, featuring a member of the Welland Centre, Natasha, who is a peer vaccinator. And from speaking to her, as someone non-clinical and someone who couldn't be a peer flu vaccinator, I feel like if I had the chance to protect my team, I would. It's amazing the trust that someone you know locally can sort of bring to you, and the questions that they can answer. So it was really interesting for me to get to speak to her, and I kind of recommend you guys go and have a look. There will be a video that follows up. But you know, the flu vaccinators, the peer vaccinators especially, having them at different locations really will make a difference. So I mean, I recommend it purely because I think it's part of what I need to do as working on flu. But actually, the way Natasha explained it was the skill set that you get from it as well, and the experience that you get from it. It not only benefits the team NHFT community, but it benefits her as well as a person, and as a clinical person. So really, for me, it's been fascinating. And I know people think we go on about flu, but there are reasons for it. And as a non-clinical person, I have learned so much over sort of the last 3 years doing flu. So with you and with the occupational health team, which makes me realise how much I need to have my flu vaccine. And I think that's some of the other, I'm very lucky in that sense that I'm exposed to it quite a lot. But more flu stuff will be coming, and no doubt Julie and I will be doing some more flu things later on in the year as well.
I'm sure we will be.
So for this Ask a Director, we will come to an end. Julie, have you got anything you'd like to add? I know you said thank you at the beginning. Anything else you'd like to say?
I think the other thing to say is thank you to you, Holly, actually, because you've been doing these Ask a Director for what, nearly 18 months, I would think. And actually, these are a real way of talking in the organisation and answering questions. So it's a big thank you to you as well, because you do an amazing job and you're so uplifting. You know, I always enjoy doing these with you. So thank you. It's just a big thank you to everybody, you know.
Yeah, everyone's just phenomenal. And I have to say the reception to these has been really good. So that's why we're continuing them, because you're telling us that they're helping. And so, you know, we take guidance from you guys as staff. So
and ask more questions.
Absolutely.
I mean, it's important that we got the questions. We've only got 3 questions today. They were really valuable questions, and they've given us a conversation. So even though there was only 3 questions, we've used it as a conversation. But actually, the more questions, the better. So please, so my plea is please send questions in.
Yeah. Absolutely. Well, thank you so much, Julie. It's been so nice seeing you.
Yeah, good to see you.
And, everyone, take care of yourselves. Stay hydrated in the weather. When it's raining, stay dry because it's been raining. And stay safe, everyone.
Yeah.
Take care, guys. Bye.
Bye.